'n groot koalisie van gesondheidswerkers het 'n reeks voorstelle voorgelê om die krisis in gesondheidsorg op te los deur strukturele hervormings wat die gehalte van openbare gesondheidsorg sal verhoog en die stygende koste van mediese fondsskemas sal beheer. Die Universal Healthcare Access Koalisie sê die land se gesondheidsstelsel kan verbeter word sonder om die NGV in werking te stel. Ons praat nou hieroor met 'n bestuurskomitee lid van die organisasie, Prof Alex van der Heever. Alex, good morning.
Good morning.
It's going to be difficult in a couple of minutes to break down the entire document that you've been working on, but in principle, how does what you've put on the table now depart from NHI?
Well, on a number of key features. One is that the first is that the health system, the approach that we're proposing, does not require that taxes are increased in order to fund the entire universal health coverage arrangement through a single fund. A government-run fund. It relies on the fact that we will operate through our existing public sector and contributions to medical schemes. The key issue that we have to do is to ensure that people on medical schemes have sustainable cover, and so that they face lower costs at point of service, and in the public sector that they have free services at point of service. So the whole framework is completely different. It separates out what's called the pooling functions of government from the purchasing functions of the health system. So it's implementable, it's sustainable, but what we're really focusing on the things that government should have been doing to stabilize our public system and stabilize our private system. And those reforms always needed to be implemented, but are effectively being held back because government is saying it's not going to implement anything structural until NHI is in, and NHI will never be implemented. So we're facing a situation where nothing will change in the health system. So we're actually emphasizing the things that government should be doing right now to correct the system.
So in other words, Prof, state remains state, private sector remains private sector. There will be intersections between the two. If that is the case, state can't remain state in the system unless it improves vastly.
Yes, it's going to have to improve, and the only way it can improve is if we separate the political parts of the system from the administration and services. So what we're proposing is that the governance structures are changed so that members of the executive of government cannot appoint people into the system, cannot remove them, cannot get involved in influence the procurement decisions, which they can do if they can appoint networks of people which are then used as parts of systems of extraction from the state. So which is basically state capture. But essentially the way you kill that is that you have a clear firewall between the executive and the services. So we've recommended the structures that do that. And that would apply not only to the provincial health services, where you would put in independent boards, etc., supervisory boards. That means not advisory boards, ones that actually supervise, hire and fire the chief executives that are not appointed by the MECs.
Right.
And at the national level, the regulators are also made independent.
Given what you already have down as concept, maybe you can apply what you have practically, and I'm just thinking of a scenario now, if you could help me. Let's say I am a cancer patient in the state system. There's a massive backlog in terms of a procedure that I need for that year in my continued treatment for cancer. How does the private sector then play a role there?
Well, they could always play a role. So firstly, that shouldn't happen. So if we had to compare Gauteng, for instance, with the Western Cape, they don't face a backlog, and they face the same financial constraints, let's say, as Gauteng, that is experiencing exactly that. They have turnaround times to get onto treatment that are the same as the private sector. But if you faced a situation where you needed to get somebody treatment, you also want a provincial administration or a provincial hospital to be able to purchase that service from the private sector to deal with that backlog. But that type of arrangement needs to be properly organized and funded. So you have to be very careful when you have to go into that sort of mode. or you're switching where part of your permanent budget is used for that kind of undertaking to pay. But it's in this framework, the issue is the province is going to be responsible for sorting that out. The governance changes will correct the corruption and the poor leadership that is a consequence of basically state government political appointments. Once you remove that and have good people in charge, they are able to solve many of these problems. It's important to note that the public health system receives a significant amount of money. It's 1 over 4% of GDP. The strain that we're seeing in a lot of the provincial departments has got nothing to do with financial constraints. It's got to do with massive amounts of corruption. The irregular expenditure is off the charts, and as a consequence, the productivity of that expenditure is very low.
All right. I've got a feeling we're going to be talking about this quite a bit, but thank you very much for your time this morning. Dit is 'n bestuurskomitee lid van die Universal Healthcare Access Coalisie, Professor Alex van den Heever.